Veterans, transitioning service members, military service members, thank you for your service to our country. Today, we're going to be talking about chronic fatigue syndrome. It is a secret rating and how to get it service connected, right? A lot of people do not know about chronic fatigue syndrome. A lot of times they think about sleep apnea and they're going, okay, I didn't get this connected, but they don't know about chronic fatigue syndrome. And it is a secret rating. Just sometimes people don't even realize, and they're like, what? I didn't even know that I could get rated for that. So I definitely want to help you and definitely give you another piece of ammunition and another tool to put in your tool bag that may be able to help you, because a lot of people are tired. A lot of people experience fatigue. And today I'm going to be going over how you can get it service connected, talking about secondary servicing, service connecting it, and all that jazz. Make sure you like, subscribe, comment, tune into this video, share this out with someone that can use this information. And most importantly, thank you for your service to our country. I am a veteran serving veterans, and I want you to be in the best position that you can possibly be in to get the benefits that you have deserved and earned. So let's get right into it. Okay. Chronic fatigue syndrome is a debilitating condition. Okay. It's characterized by cognitive impairments, extreme fatigue, amongst other symptoms as well. So, if you are filing a chronic fatigue syndrome claim, understanding the critical role of the compensation and pension exam is essential to build a strong claim. Okay. It's very, very important. And obviously, you always want to go with as much ammunition as you can and provide everything on the front end of your claim so that you get the results on the back end. So I'm going to walk through all those different angles, the best strategy, and what you need to do and how you need to go about doing it. Okay. A compensation and pension exam. I don't want to insult your intelligence, but you have companies, QTC, Optum, Veterans Evaluation Services. They are contracted. They are third-party companies that are contracted by the Department of Veterans Affairs to administer and fill out your disability benefits questionnaires, where ultimately your rating derives from, and they do your compensation and pension exam. So it's very important for you to know that. And a CMP exam evaluates the severity of your condition, whatever condition it is that you are filing for, and they fill out a disability benefits questionnaire. So there are disability benefits questionnaire from musculoskeletal, mental health, chronic fatigue, headaches, hearing, all of that. And they're looking at how are you impacted in your daily life and its connection to your military service, right? Ensuring that you receive the VA benefits you rightly deserve. Let me hit the pause button right there. Okay. Think about this. If you're submitting the claim, and let's call it chronic fatigue syndrome, right? You're submitting that claim in. Okay. Remember, it's going to a VSR, it's going to a rater, it's going to an adjudicator that is not trying to give you any more than they need to. Okay. I'm not saying some aren't trying to be helpful, but that are not trying to give you any more than they need to. Okay. That's number one. Number two, then you're going to get a compensation and pension exam. And a lot of these doctors that are contracted by the VA that work with Optum, Veterans Evaluation Services, QTC, they are not up to par, or educated in the veteran affairs and the benefits. Okay. They're just not. They're not familiar with it, right? Many veterans say, man, I've went to a compensation and pension exam and I looked this doctor up and they're not even the right kind of a doctor. I'm going for PTSD. This isn't even a psychologist, or this was just a physician's assistant, not even a medical doctor. Okay. But you look and see that they don't have a lot of education because the VA is in desperate need of doctors, because a lot of people are not educated in this on how to write nexus letters and fill out medical opinions. In the case of the VA, they're not familiar with, you don't go to college for filling out disability benefits questionnaires. So it's important, whatever claim that you're filing for, that you go with all the evidence that you submitted with your claim, and do not assume that the VSR, that the adjudicator that is looking at your claim has given them all that information, because 9 times out of 10, they have not. all the evidence that you submitted, they pick and choose what evidence they want to give to the compensation and pension examiner. So I want you to know that, and I want you to be prepared. So if you have a compensation and pension exam coming up for whatever condition, make sure that you bring all the evidence that you submitted. Remember, you are your best advocate. You must be prepared. You got to know what is in your claim that you're submitting for whatever condition it is. Okay. So I got a little sidetracked there. Okay. But I just want to really articulate that on a compensation and pension exam. It's very important. Okay. So that CMP exam evaluates the severity of your condition, its impact on your daily life, and its connection to your military service. Okay. So, I want to get into some key points and topics I'm going to talk about today. So, if you're a veteran or you have served or you're in the military now, you are at risk for developing chronic fatigue syndrome due to factors such as exposure to stress, okay, environmental hazards during active duty, and the physical and psychological toll of your military service, okay? A compensation and pension exam is conducted by a VA healthcare provider or contracted medical professionals and helps evaluate a veteran's disability and whether it's connected to their military service. Also, you can bring a Nexus letter, a disability benefits questionnaire from your own doctor. Just make sure they know what they're doing and know how to write a proper Nexus letter and have the proper research in there as well too, okay? You can prepare for your CMP exam for chronic fatigue syndrome, obviously, by being prepared, by watching channels like this and others out there, documenting your symptoms, making sure that you have everything up to date. I cannot stress treatment enough, making sure that your medical records are up to date, right? And reviewing the 38 Code of Federal Regulations, the CFR, for the VA's criteria for chronic fatigue syndrome. It is super important to make sure that you understand what the VA is looking for, okay? Prepare for the exam, prepare for the test, understand what the VA needs. Don't just throw mud at a wall and hope that it sticks, okay? So let's understand chronic fatigue a little bit, okay? Chronic fatigue syndrome, it is a complex disorder characterized by persistent, debilitating fatigue that is not relieved by rest in some cases, okay? CFS symptoms, chronic fatigue symptoms include joint pain and muscle aches, okay? So generalized discomfort and migratory joint pain, cognitive impairments, difficulty concentrating sometimes, memory issues, and a mental fog. Debilitating fatigue, extreme tiredness that restricts routine daily activities or self-care. Sleep disturbances, you have trouble falling or staying asleep, leading to poor restorative rest. So you're constantly feeling tired. Do you wake up and feel like you've never gotten any sleep at all, even though you know that you laid down at 9 p.m. and it's 7 a.m. right now, but you don't feel rested at all? You're just walking through your day fully tired. Then you may have chronic fatigue syndrome. Low grade fever, a potential symptom indicating an underlying issue as well too. Could be. Also, there are symptoms exacerbated by exertion. Both mental and physical activity can worsen the condition, okay? For Gulf War veterans, these symptoms may overlap with Gulf War syndrome or other medically unexplained chronic multi-symptom illnesses stemming from their service in the Southwest Asia Theater. I'm going to repeat that again. For Gulf War veterans that were in the Southwest Asia Theater, these symptoms may overlap with Gulf War syndrome or other medically unexplained chronic multi-symptom illnesses stemming from your time in the Southwest Asia Theater, okay? So again, I went over what a CMP exam is, right? It's a medical examination scheduled by the VA to gather more information about your claimed disability, okay? Again, they are conducted by VA healthcare providers or contracted medical professionals to evaluate the severity of your condition and determine whether you're service connected or not. Remember, if you submit up your claim on your own and you throw that claim in, you're going up against the VA, the rater, right? And you're going up against that CMP examiner. So make sure that you're prepared. Make sure that you know what is in your evidence. Make sure that you bring all your medical evidence in your full packet or all the evidence that you submitted to that medical exam. And you ask that CMP examiner, hey, I'm coming for chronic fatigue syndrome. Hey, I'm in here for PTSD. Did you see what I wrote on my 210781 PTSD statement in support of claim? Did you look at my packet? Did you look at my statement in support of claim? Did you see my buddy letter? Did you see my outside doctor or psychological doctor's psychologist outside medical opinion? Did you see that? And do you have that? If not, here you go, sir or ma'am. Bring that. And don't minimize in these exams. Don't lie. Don't minimize. Okay. There are no known tests to screen and diagnose CFS in veterans, but I'm going to talk about blood tests, okay, that the VA does use and that they like to see to eliminate and rule out any underlying factors that may contribute or cause chronic fatigue syndrome. And however, the compensation and pension examiner may conduct lab tests, again, known as blood work, to help rule out any other chronic conditions. It's important for you to know that if you're filing for this condition, okay? So what should you expect when you go into a compensation and pension exam for chronic fatigue? The compensation and pension exam for chronic fatigue syndrome will typically involve a physical evaluation and a discussion about your symptoms and your medical history. All right. So make sure that you have treatment and that it's up to date and that you're complaining about this and that it is a legitimate issue. If you don't have any up to date treatment and you're complaining about something or no diagnosis within the past 12 months, it's going to be harder for you to get it service connected. And remember, always you need to be thinking, how am I going to service connect this condition? Did I complain about chronic fatigue syndrome while I was in, or did I not? And if you did not, then you need to be thinking about, or if you're listening to me now, how am I going to service connect that? Here shortly, I'm going to give you some tips and some other conditions that you can secondary chronic fatigue to, and how to secondary your chronic fatigue syndrome as well. Okay. So again, you can expect the following during your compensation and pension exam: review of your medical history, active duty, and post duty. The examiner will review your medical records, including private medical records and any documentation submitted during the VA claims process. Okay. Again, it's not going to be all VA documentation that they're looking at all the time. It may be what the rater or the adjudicator gave to them, which may not be that Nexus letter, that service connecting you secondary to your PTSD, that, the chronic fatigue to that. It may not be that. So they look at everything. They're supposed to look at everything, but they don't. That's why there's a lot of duty to assist errors and clear and unmistakable errors. But reviewing your medical history helps establish a timeline for when symptoms began and also whether they align with a presumptive period or an active duty time frame, okay, when you were in. The assessment of symptoms is important in chronic fatigue. The examiner will evaluate chronic fatigue syndrome symptoms, including debilitating fatigue, cognitive impairments, and physical limitations. They may ask about, how does fatigue restrict your routine daily activities? The frequency and the severity of your symptoms, such as joint pain and or maybe a low-grade fever. How physical or mental exertion exasperates your symptoms, okay? And then they always want to know, what is your functional impact? The Veterans Affairs needs to understand how chronic fatigue syndrome affects your daily life. Be prepared to explain how your condition impacts work, self-care, and other activities. Let me stop right there. You should have a statement for every condition that you are claiming, and that should already be explained, and you should be bringing that to your compensation and pension exam. So, hey, I am tired. I go to sleep, and I wake up, and I do not feel rested, and then I go throughout my day tired and fatigued. Here's my blood work, sir or ma'am. This is how I'm impacted occupationally and socially, right? I have to miss work. I have to take off of work. Here is a log. Here is proof that I've had to take off work 2 or 3 times, and it's impacting me occupationally, okay? And then I'm becoming irritable, and I'm screaming at my wife, and I'm screaming at my kids, and I'm yelling at everybody, and I'm mad and stomping around, and it's impacting me socially as well, too. Remember, VA disability is not Social Security disability. It is replacement income, and it is based off of the Global Health Assessment Scale, occupationally and socially. So in every statement, you need to be focusing on how am I being impacted occupationally and socially. It's very important. Okay. So it's very important to explain your functional impact occupationally and socially. I can't stress that enough. Medical evidence, providing detailed medical evidence, whether that's active duty medical evidence, if you're secondarying it, which again, I'm going to get to here in just a minute. Do you have up to date diagnosis? Do you have a disability benefits questionnaire? And how are you proving that your PTSD impacts and causes your chronic fatigue syndrome? Okay. You cannot secondary something if you don't have that condition. And if you do have that, let's call it PTSD, you need to prove how PTSD impacts chronic fatigue syndrome. And that is with medical and scientific research that a doctor needs to provide in a Nexus letter, proving how A causes B, how PTSD causes chronic fatigue syndrome. If you don't prove that point, how are you going to establish Nexus? How are you going to establish service connection? Remember, if you didn't complain about it while in, then the presumption of soundness, that's another video that I have. That's what the VA is going to presume. They're going to say, you didn't complain about it while you were in. Too bad, so sad. So then you got to work around, and there are other ways. That's why I do these videos, to share with you secrets, tricks, tips that the VA does not give you, so that you can secondary some of these things and do it properly and effectively the first time. Okay. Medical evidence. Let me get into that. Providing detailed medical evidence, such as reports from your healthcare providers, your active duty records, VA, complaints and treatments, can strengthen your case. A history of continuous medication or other treatments can also be helpful. Look, if you're getting medications issued for that issue and you're complaining to the VA and it's going into your My Healthy Vet, it shows that there's a history of care and that it's a legitimate issue. But if you submit up a claim and you don't have any care and you're saying that it's so bad, but you can't prove any care or treatment for that, how do you expect the VA to give you a rating for that, or a high rating for that, or to be properly rated? Okay. It's tough. Special consideration for Gulf War veterans. Gulf War veterans, hear this. You may qualify under presumptive service connection if chronic fatigue syndrome is part of an undiagnosed illness of Gulf War syndrome. Okay. You may qualify for that under presumption. You should never exaggerate your symptoms at all. Don't lie about anything. If it's not true, don't talk about it. But you need to not sell yourself short. You need to express how it is at your worst. It's important to paint a clear picture of the frequency, severity, and duration of your CFS symptoms and how they've developed over time. Okay, I'm going to give you an example here. Sir, ma'am, I'm tired. I'm tired all the time. Okay, but you're maybe not missing work every day, but 2 times out of a month, I'm having to call off of work, or I'm having to miss work, and my boss is becoming very irritated right now. And or I used to work at the mall. I don't work at the mall no more, and I work in a sheltered environment at home, because getting up and having to be somewhere at 9 and getting off at 5 is just not happening anymore, because I get so tired and I oversleep. And I was doing that and I got fired from my job, or I missed so much work that it became a problem. My boss said it's best for me to go, and I had to find a work from home job because of my chronic fatigue. And that's truthful if that's your case, right? But be honest about it. Don't over exaggerate. Don't lie about it. Those make things unbelievable. And, they're already looking at your case and your claim as not wanting to give it to you if they don't need to. Okay. So how do you prepare? Okay. Nothing is guaranteed. I've heard veterans say things are guaranteed. No, nothing is guaranteed. However, you need to put yourself in the best absolute position that you can, right? And you need to be prepared. You need to be proactive rather than reactive. There are a few ways that you can prepare for your compensation and pension exam, including quite a few things here. Okay. You need to document your symptoms. That's very important. Keep a journal of your chronic fatigue syndromes, noting their frequency, severity, and impact on daily life, just like you would a headache log. Keep track of that, okay? Gather your medical records. Include records from the VA, private providers, active duty records. Provide everything that you can. The more evidence that you come with, the better, right? And always know, did I complain about this on active duty? Did I get a diagnosis, or did I go and complain to a medical professional while I was on active duty, or reserves or guard while I was on drill or reserve weekend or during this time period? Make sure, if you can, have a line of duty as well too, an LOD. So provide medical records, provide medical evidence, and be honest and thorough during the exam. Clearly describe your symptoms without exaggeration or omission. State the facts. If you have things written down, you can clearly articulate it, and you can say, on this date, December 6th, I didn't go to work today because I was tired. Okay. December 4th, I didn't go to work today because I was tired and I missed a whole day of work. In the month of December, I've missed 2 days of work so far because of this. And on average, when I look back over the past 6 months, I'm averaging 2 to 3 days of work that I am missing. And that's how I'm being impacted occupationally. And I'm so tired that I'm not waking up, and I'm getting mad and I'm getting upset. And here are things that is happening in my relationship. And if you want your wife or your spouse or somebody who knows you, right, to write an honest lay statement, do it. Write a buddy statement. Write a statement saying, hey, you know, Bobby used to be this way. Now Bobby acts this way. Billy used to be this way. Now he acts this way, right? He's got this. So familiarize yourself with the VA disability ratings for chronic fatigue syndrome to better understand how your condition will be evaluated. Go to 38 CFR. You can Google it and look up chronic fatigue syndrome to understand how your condition will be evaluated. Okay. The next important thing that we really want to talk about is we want to get into your DBQs, disability benefits questionnaire, right? People sometimes get confused about that. What is a disability benefits questionnaire? What is a nexus letter? Okay. Nexus letter is medical scientific literature proving how something causes something. A doctor needs to write it. It's not just a statement saying, hey, it's highly likely, in fact, more probable than not, that PTSD causes chronic fatigue. That's not what it is. That's part of it going in there, but it's proving, hey, Johnny Sue, Johnny Joe, whatever, was involved in Vietnam and he's got PTSD, and here's incidents that happened, all right? Or he's got chronic fatigue. Here's what happened. He didn't get treatment after he got out, but this is an ongoing issue. Here's up-to-date diagnosis, etc., right? And if it's secondarying, if you're secondarying it, you need this disability benefits questionnaire. And you need a board-certified medical doctor to fill this out. A sleep doctor, preferably. A psychiatrist can also do it, especially if you're secondarying chronic fatigue to PTSD. Yes, that is a thing. I told you I was going to talk about that. PTSD, depression, mental health symptoms can absolutely cause chronic fatigue, right? Again, make sure that you have a current diagnosis. If you make sure that you request information and provide information if you had acute onset of chronic fatigue syndrome, restriction of routine daily activities. You need to document this. Evidence of cognitive impairment due to chronic fatigue syndrome. How are you impacted? The frequency of symptoms and the physical symptoms as well too, right? DBQs are not required with VA disability claims. However, there are instances where they are absolutely beneficial, right? And you can Google chronic fatigue syndrome DBQ and download it and take a look at it and see what that C&P examiner is going to be filling out. It's all available for you. All the DBQs for every kind of condition, and to include chronic fatigue syndrome, are available online for you. You can Google them, download them, and take a look at what the doctor's going to ask you, okay? So a DBQ for chronic fatigue syndrome, again, request information about current diagnosis, if you had acute onset of chronic fatigue syndrome, restriction of daily activities, how are you impacted daily, occupationally, and socially, evidence of cognitive impairment due to chronic fatigue syndrome, frequency of symptoms, and physical symptoms. So proving service connection for chronic fatigue syndrome, right? You have a couple of ways. Okay, I'm going to use the period from 2010 to 2024, December 6th, the day that we are live right now. Okay, if you just got out December 5th, okay, then from 2010, December 5th to now to yesterday, December 5th, did you complain about chronic fatigue while you're on active duty for those 14 years? Did you do that? If you did not do that and you don't have a diagnosis in your active duty records, then how are you going to prove service connection on that? Okay. So again, now if you get out and you get diagnosed with PTSD, or let's say that you have sleep apnea, right? And you have issues of chronic pain from joints, musculoskeletal, arthritis, you have migraine headaches and all of that. Those can be contributing factors that absolutely impact mental health, mood, right? Mood disorder due to physiological conditions. My headaches are so severe that it's impacting my mood. My back and pain and arthritis and radiculopathy and plantar fasciitis is all a ripple effect to my mood, right? And due to that, I'm losing sleep. But again, now you need to prove how this chronic fatigue impacts your daily life, and how are you going to connect that? You can't just say, I'm tired because of this. And some people do that and then they get denied. And then the VA comes back in the rating decision letter and says, you need to provide a nexus, a link, or prove how A causes B, how depression or PTSD impacts your chronic fatigue. I'm tired because I'm having flashbacks. I'm tired because I'm having anxiety, one of the symptoms of my PTSD, et cetera, right? Or my pain is causing me not to sleep at night, even despite the fact that I'm taking medication, I'm taking some gabapentin or whatever, it's still impacting me and I'm not getting the proper rest that I need. So here you go. You need a current medical diagnosis of chronic fatigue syndrome. So if it's in your active duty records and you got seen for it and you have a diagnosis, file that claim. But outside of that, post duty, right? So you got out yesterday. Today's December 6th. Well, a day after you got out, right? That is still a presumptive period, because you still have a year. After a year of getting out, complain to the VA, complain to your medical doctors, et cetera. And you still have your year of, your year of TRICARE benefits and things like that. So go and complain, do all of that. However, make sure that you have a current medical diagnosis of it. If you do not, then now you need to figure out, how am I going to get chronic fatigue syndrome and what am I going to connect it to, right? Make sure that you have an in-service illness, injury, or event. If you're going to secondary something because you didn't complain on active duty, that needs to be rated on your disability breakdown letter. You need to be approved and it needs to be service connected, 0% service connected or higher, if you're going to try to link nexus that chronic fatigue to whatever condition. Let's call it PTSD. And then again, you need a link between your military service and medical condition. So you're secondary in the PTSD that is service connected now, right, to your chronic fatigue syndrome because you didn't complain about it while on active duty. You're showing how this causes this, but make sure you have a competent doctor that knows what they're doing. If you need a Nexus letter or a DBQ, you need someone that's going to thoroughly look through your records before whipping up a Nexus letter. Look in the description of this video, Dr. Prashant, Dr. Lopez, right? Quality Nexus letters. There's a few companies out here that are very reputable, that are very fair, that are less than the national average and truly want to help you out, okay? If they can't do it, they're going to tell you and point you in the right direction of what you need to do before they're just whipping up a letter, okay? So again, direct service connection requires current medical diagnosis of chronic fatigue syndrome, in-service illness, injury, or event, a link, a nexus between military service and medical condition. Secondary PTSD causing chronic fatigue requires also current medical diagnosis within the past 12 months, preferably as up to date as possible. Complaints in your records as well too, your VA records. Complain, get treatment, complain, get treatment. Make sure you have everything documented. Be very thorough. right? An in-service illness. In this case, it would be PTSD because you're secondarying it to it. That's the injury that occurred, the PTSD. You're service connected for it. The event is due to the PTSD and pain or PTSD. It's impacting the chronic fatigue syndrome. Okay. And then the link. You get that Nexus letter, right? It's got all the proper medical and scientific literature written by a board certified, qualified professional who can do it outside of the VA. Then you get that connected. Again, diagnosis, in-service illness, injury, or event link. Okay. I know that's a little long winded, but I want to make sure that you understand that very, very clearly. Okay. Um, Chronic fatigue is not easy to get connected. Um, they can be a pain in the butt about it. So make sure that you know that you have treatment for this condition. Okay. Sleep apnea can also impact chronic fatigue as well too. Some raters don't like to give both, because they're like, okay, you got a 50% for sleep apnea, but you still can get chronic fatigue. However, you could be fighting an uphill battle even with a DBQ nexus and diagnosis or doing it secondary, right? And just because you do things the right way does not mean the VA is not going to mess up, or that you're not going to have a little battle and that you're not going to have to fight a little bit and argue your point, right? But the more treatment, the more things that you have documented, and the more evidence, the nexus, the disability benefits questionnaire, up-to-date diagnosis, and all of that is very, very important. How does the VA rate chronic fatigue? They rate chronic fatigue syndrome at 10, 20, 40, 60, and 100, right? A lot of averages are 40 to 60 range. And I've known somebody that's gotten 100% chronic fatigue as well, depending on how severe it is. Every rating is dependent on how severe it is. So if you sell yourself short, let's digress here and go back to that C&P exam. At that compensation and pension exam, and it's not that bad, and you don't have anything documented or whatever, expect a lower rating on any condition. If you sell yourself short, then you're not going to get as high as you need to be. And then on the other side of that coin is C&P examiners often screw over veterans too, or they're uneducated on what they're doing, and the veteran ends up getting rated low. So you just don't need to minimize, and you're your best advocate. You need to go in prepared, right? Have everything documented and all that. Again, the chronic fatigue rating will depend on factors like restriction of routine daily activities, the degree to which the fatigue limits your ability to function, frequency and severity of symptoms, such as extreme fatigue, joint pain, and cognitive impairments, the need for continuous medication, whether treatment is necessary to control the symptoms, etc. It is very, very important. Okay. Secondary conditions, as I promised here, they occur when a service-connected disability has been caused, or has aggravated a new or pre-existing condition, illness, or injury. You must be rated. It must be 0% or higher. It must be service-connected. Chronic fatigue syndrome may lead to or exacerbate other conditions, including mental health conditions. I was just talking about it, and I was using PTSD as an example. PTSD, depression, and anxiety due to the impact of chronic fatigue on your daily life, right? But again, DBQ nexus diagnosis if you're going to secondary it. Number two, secondary conditions to chronic fatigue syndrome, functional gastrointestinal disorders such as irritable bowel syndrome, IBS, as well too. IBS can be a contributing factor and can stem, and those two correlate, chronic fatigue syndrome and IBS. Heart and lung issues caused by prolonged stress or inactivity, right? You're so tired, you're not doing what you used to do, your daily life is impacted, inactivity, and or you're so stressed because you're not getting sleep or whatever, it can impact you. Okay. If you experience those conditions, those may qualify as secondary disabilities, potentially increasing your VA disability rating. Mental health conditions, number one, functional gastrointestinal disorders, heart and lung issues as well, right? But again, you need a Nexus DBQ diagnosis. It's very, very important to understand all of that, okay? I want to answer some questions here. What's up, Angel? Shout out to you, brother. What is your experience seeing the VA grant 100% for Gulf War presumptive CFS? It is very slim. I've seen one person get 100. A lot of people do end up getting 60%. A lot of people do. So, but again, you need to have the right, Nexus letter and all that. It's very important, and make sure your treatment's up to date. So before you get a Nexus letter, make sure your treatment is up to date and you're complaining about it, especially if it's secondary. So I hope that that answers your question. It's very slim. 100% for anything is pretty difficult to accomplish. You can get there, but again, it depends on, it must be extremely severe and be the max that the VA considers severe to get 100% for CFS. Typically 40 to 60% range is where it's at. Again, if you go on your own and do it, and maybe it's in your records, and then you have a bad C&P exam, expect a 0, 10, 20% rating, something of that nature too. But if you're rated low and you're service connected, remember, you can always go up with that as well. Angel, I'm glad to serve and help, bro. Thank you for your service as well too. But if you have any questions regarding that or anything like that, and if you do need an Nexus letter, if you're listening to this now live or later, make sure that reach out to Dr. Prashant. Really, really good with them. Make sure that you get the right help that you need. Somebody that knows what they're writing as well too, and knows what they're doing. So those are the key things that we've talked about today. Compensation and pension exam is key. Knowing what you're rated for, why you're rated for it, and what is needed. Okay. Make sure that you document it. Make sure that you're getting the treatment that you need. It's very important. Understanding what the compensation and pension exam is and being prepared. You need to understand again that the C&P examiner does not always have all your medical evidence. You need to bring all that evidence that you submitted to your C&P exam if you get one. Okay. You may not get one if all your evidence is right. They may just do an ACE exam, review it, look at your treatment, right? If you have treatment and a good Nexus letter and diagnosis and all of that, and you come prepared in a good statement and everything's very clearly documented, you may not get a C&P exam too. I've seen that quite a bit as well, right? From people, and I've heard about that. So that's very important. And if you have some physical conditions, right, let me know. Hit me up. I can tell you if maybe you can secondary it or have a good chance. Again, though, the one thing that no attorney, nobody, no VSO or anybody can do is get the treatment that you need. You're responsible for that too, and you're responsible for your education as well too. So again, all of your VA symptoms are how are you impacted occupationally and socially. It's very, very, very important to know that, to take a look at that, and to see how you're impacted on a daily basis. If there's any other questions, I will answer those right now. I'll take a couple minutes here, and if there's not, that's okay. You just let me know, and I hope that you watch this video, share it out with people that can absolutely use this information. It's very, very important. And share this out with a veteran that can, that can use it and be in the best position to win their claim. This may be the deciding factor to take you over the top from 90 to 100 as well too. So if there's any other questions, hit me up, in the chat, and I'll definitely answer it. If not, I really hope that this helps you. Again, chronic fatigue is a secret rating that a lot of people just don't know about, and can be secondary to conditions if you have not complained about it in your active duty records. So thank you guys for tuning in today. I really hope that this helps you. If you do need anything, reach out, info@veteransclaimservice.com. Thank you guys all for your service. And there's going to be much more. I'm going to start doing straight up live Q&As with members. I'll be creating memberships in 2025. That way we can just get together and I can answer any of your questions. Any of your questions, I'll be able to answer. I have seen it all and seen a lot. And I don't know, I think any other condition on how to get it connected, we're up to date on that. We're staying on top of the education so that you guys can be in the best position to get the rating that you deserve. So, hey, thanks for your service. Thanks for tuning in. Like, subscribe, comment, share this out with someone that can use this information. You matter. We care about you. I am an Army veteran serving you and want you to be in the best position to win your claim. Thank you for your service and happy holidays to you guys. Look forward to talking with you more. I hope this helps you out. Bye-bye.